I'm Emma Sutherland, clinical naturopath, author, mum, and your host. With over 20 years in clinical practice, I've helped thousands of women and their families transform their health using evidence-based integrative strategies. I am deeply passionate about making science simple and actionable so that you feel confident and empowered in your health decisions. This channel is your go-to for trusted insights, expert conversations, and practical tools that support your real life wellness. Welcome to our two-part deep dive into the biological drivers and nutritional interventions in autism spectrum disorder, featuring Naturopath Lynn Joels. In this series, we'll explore the fascinating and multifaceted connections between early nutritional factors, the gut-brain axis, neuroinflammation, and environmental toxins, as well as how these shape brain development and brain function. In part one, Lynn will unravel the mechanisms from prenatal nutrition to immune dysregulation, microbiome disruption, and toxin exposures that contribute to ASD pathways. Then, in part two, we're going to shift focus to practical dietary and therapeutic strategies, examining the role of gluten, dairy, preservatives, and nutritional treatments in supporting brain health and behavioral outcomes. Lynn, so lovely to have you with us today. Thank you for joining us.
Hi, thanks for having me.
Absolute pleasure. Now, to get us started, Lynn, can you tell us how you became interested in treating kids with autism? Because I know it's your thing. You're so good at this.
Bit of a passion. I guess kids have always been a passion from my nurse training right into my naturopathy journey. It's like little people. I always say little people, but they go all the way up as well. But little people have just always been a passion of mine. Neurodivergence specifically, I guess, came about because there's such a need. It's an under-resourced, underfunded area where there's kids sitting on wait lists for here in WA for years to see pediatricians, and they're struggling, and the parents are just wanting something. And I feel that there was a hole, I guess, in that sort of also more holistic view of the child, because it's not just the medical model. So again, I'm hoping that I can just begin to potentially fill a bit of a gap and, yeah, support kids and families as best I can.
Yeah. And when someone has a natural passion for something, it really shines through. I also know that you've done extra training with the Medical Academy of Pediatric and Special Needs. Like you're really dedicated to staying on top of not just the latest research, but what other people around the world are doing in this space.
Absolutely. Yeah. That's a full-time job in its own right, as you well know, right?
Very true. That's so true. And then to get us all on the same page, I guess we should look at an overview of autism so that we can all just have the same framework for this two-part series that we're doing. So can you share us some information on an overview of autism?
Yeah, there's always a lot to say on autism, but yeah, just I guess top line, autism spectrum disorder, or as you'll probably hear myself and MSA and various times throughout this chat today, ASD. It's a very complex behavioral syndrome that involves speech and language. It involves learning and motor dysfunction. It has its intellectual challenges. I think current stats say there's about 1 in 68 children in Australia, but again, we know there are bucket loads of kids sitting on wait lists that are yet to be diagnosed. I also think it's a very underdiagnosed area. So that number is, I think, an awful lot higher than that. The exact causes are unknown, but what we do know is that there's several factors that come into play, from genetic, biochemical, environmental factors, things like metabolic and immunity, gut function, which we're going to delve into a lot more today. There's a hereditary component of upwards of about 60%. Again, the science waves a little bit in that kind of number. Pollution, maternal factors, diet. But I think it's probably really key for today's talk as well to, I guess, understand that it's that complex interplay between all of those things. So it's genetic, it's neurobiology, it's environmental. And I guess it's probably important as well for today's talk to go on and say that there's, I think it's about a fourfold increase of kids with ASD that have got gut issues. Now, those gut issues can be quite generically constipation, diarrhea, pain, but they also have a susceptibility for infection, like gut infection. So increased permeability, which is leading to things like reflux and H. pylori, gastritis. So a lot of those inflammatory conditions, and another word that you're going to hear a lot about today. Yeah, so I guess the response to all of that is inflammation, and we're going to unpick that as we go today. Will be a common thread. So I'd say get a notepad ready, get a pen, write down anything that you're not understanding so you can go and check it out like that. And let's get into it.
Right. And as you said, it is so multifactorial. There's no one cause. But what about prenatal nutrition? Things like folate levels, essential omega fats, vitamin D. How does that interact with genetic susceptibility? I think there's a lot in this space.
There's a lot in this space. I think touching on maybe, yes, 3 key nutrients is really good. I think suffice to say, just at the beginning, there's probably key areas of the body that we're talking about today. So I'm talking about everything from here all the way down to what comes out your other end. You can't see where I'm necessarily pointing, but it's everything in between. So that's kind of the main body focus of today. So yeah, I guess starting at the beginning, pregnancy is a period of incredible brain development. And during that time, I guess the fetus is just really sensitive to environmental exposures. So pretty much everything that mom's doing and everything that's going on in the world around that baby, despite it being inside. So pre, peri, and postnatal risk factors are well known, and there's a lot of science out there with the associations with ASD, which is cool, anything that gives us a science. So folate, or B9, as we often hear it called as well, and folic acid, I guess it's important to note in pregnancy, the synthetic version, as we like to say, integral in rapid tissue growth and cell division through fetal development, really important in brain development, DNA regulation, gene expression, neurotransmitter production, and myelination. And I always like to explain that as the little huggy jackets that go around our nerves that allow our nerves to talk to each other.
Love that.
Yeah, so really important in pregnancy. We get it in our veggies, citrus, seeds, nuts, eggs, probably some of the key foods where we're getting our folate. Fatty acids, often again referred to as your omega-3s or your fish oils, as they're, I guess, commonly referred to. Again, a really critical role in early fetal development and the structure and function of cell membranes and neural tissue. So again, 2 key nutrients, we're talking about the brain. So your fatty acids, obvious places like fish, yes, but then seeds, nuts, and all your beautiful leafy greens. And then vitamin D3, I think this one often gets missed out and lost in translation because it's sometimes referred to and actually acts as a hormone in the body, and it's involved in bone formation and the regulation of the central nervous system, which again, in fetal development, 2 vitally important things to get your little baby, and really important again in neurodevelopment in pregnancy. So we've got 3 key nutrients that are obviously sitting with the nervous system and our brain, so you can see their role. The vitamin D3, again, you'll find it in your fish, you find it in egg yolks, some of your organ meats, and then yes, the obvious little one of the sunlight. So I think when we combine, or we look at combining these nutritional factors with our environment and our genetics, we get an impact on the gut-brain axis, which may affect cognitive function and is loosely being termed the cause of ASD. And obviously, we're talking about genetically susceptible individuals here, so not across the board.
When you're talking about that gut brain immune axis, can you talk us through it? The interplay between gut dysbiosis, immune activation, neuroinflammation. It's complex, but yet how would you explain it to somebody?
Yeah, and I think that's key for us as practitioners, isn't it? It's taking the complexities and finding simple ways of
Yes.
talking about them. And I'm a very visual human, so I talk in pictures a lot. So as I mentioned, children with ASD are a lot more susceptible to GI disorders. Like I see a lot of constipation, abdominal pain, bloating. And again, they're quite generic. However, they're key kind of signposts for us as practitioners. So all of these things lead to malabsorption and things like digestive enzyme deficiencies, which we know are caused by inflammation. This goes on to cause things like food allergies, nutritional deficiencies, anxiety, and we'll unpack that again a little bit more shortly. So this kind of, I guess it's like a vicious cycle. So we get stuck in this dysbiosis, inflammation, vicious cycle of GI brain dysfunction, or the kind of gut brain axis. And simply put, I like to say there's a little superhighway that runs from here to here, what the mice known as the vagus nerve, supported by the para and sympathetic nervous systems, and obviously various conversations that happen between things like the brain and the adrenals. So we have gut inflammation, we have brain inflammation, or as Emma's put it, neuroinflammation. This leads to immune dysregulation, which then in its own right leads on to things like sensory sensitivities, as well driving things like selective eating habits, hypersensitivities to textures, leading to more nutrient imbalances, which further exacerbate malabsorption. So you can see this awful vicious cycle that we just get stuck in. I guess to your point, how is the inflammation getting to the brain? Via our beautiful little superhighway. But as we now know, inflammation's breaching the blood-brain barrier. I always have to say that one slowly. It activates, which fundamentally activates immune cells, which is promoting inflammation. So the brain's basically run by microbes that are sent by the gut. So we used to think it was an aseptic environment. We now know that it's not. And as I said, I think very visually. So I always like to say to my kids and my parents, if you imagine the little Inside Out movie where you've got all the
Yes.
people up here that are all pushing buttons and doing the groovy thing, that's how I see my brain, full of colorful characters. And I like to say the brain kind of leads the show through bacteria. And then the brain's like the processing chip. But obviously it's then impacting 40 million brain cells. So you can kind of see the correlation. Pretty cool.
It's mind blowing. And I think as much as we know about the gut and the brain axis, I can't wait for us to have another conversation in even just 12 months and how much things will have changed from there. But that neuroinflammation is so common in ASD. And I've heard the expression a number of times the brain is on fire because of the amount of inflammation that's going on in the brain and then how that then affects the rest of the body. And I love how you described this vicious cycle that just keeps going and going. And it's a chicken and the egg. By the time a patient comes to you, it is a chicken and the egg. And we don't know what happened first or when, but this picture is this complex interplay between gut, immune, and inflammation. So I guess there's so many questions I have, but one of them is that how does that affect the behavior of the child? Because when it comes to parents, they're just getting to look at the behavior of the child, and maybe that child isn't fitting in the norm of school of sitting on the mat when they're 5 years old with all the rest of the kids. But how does that affect their behavior, that neuroinflammation and that gut dysbiosis? What do you see clinically?
Yeah, there's probably a couple of questions in there. Yeah, it's the key role, I guess, of the microbiome. And as we kind of briefly touched on, our microbiome being its little diverse community of microorganisms, my little finger all getting going, interacts directly with our central nervous system through things like the regulation of our neurotransmitters, through immune system modulation, through the way in which we ferment and break down our foods. So it's always talking to our brains. So I almost like to say, so if this is unhappy, this is unhappy, if this is inflamed. So we know in ASD specifically that microbiome diversity, both, I guess, the abundance of and the reduced diversity of specific bacteria are associated with ASD symptoms. And then obviously we also know in ASD, there's often like ratios that are out of whack. So it's not just an overabundance or an underabundance, it's the ratios of certain bacteria that are then playing a part and sending up more inflammation to the brain. So obviously this leads us again to a susceptible gut, to dysbiotic bacteria, which again cause inflammation. And as we keep saying, it's like when this is inflamed, that's inflamed, which is affecting both neurodevelopment, but that in its own right through key stages of little babies. But as we go on to some of the key brain stages of 3, 4, 5, right the way through to teenage years, this is just going boom with regards to all of the neural pathways that are being laid down. So if the messages that it's getting throughout all of that developmental time are delivered with inflammation, we're not a happy brain, which means we're not a child. And again, a lot of it is within those areas where children emotionally regulate. So we have kids that are being naughty or that won't sit still. And fundamentally, it's not that they're being naughty. They have the inability biochemically to sit still.
Yeah, and I think this is a big thing that I'd love to dispel is that a lot of parents, when they come in to see me and they bring their child, they have just this messaging that has been going on for sometimes years that their child is just disobedient or their child just doesn't listen or their child just doesn't. And I think what you just said there was beautiful. This child is not capable of doing that because of the neurobiology, because of what's going on in their brain, what's going on in their gut, and what's going on in their immune system. It's not that they are a naughty child. And I really feel for parents in this space because of that.
Yeah. And obviously, all we can do is educate and just hope that, yeah, we can get some messaging out there that just makes, yeah, allows, I guess, even society, and we're getting better, but get society understanding that this is bigger than just a naughty child.
Absolutely. I should have said at the beginning, for people that are not aware, ASD is not something that is medicated. So, can you just give us a little overview of that and things like ADHD? They're not the same thing, and a lot of people get confused between them.
There's a lot of differences between autism and ADHD. They do often come hand in hand, and you will obviously often hear that ADHD or autism has a friend. It is often one or the other. Yeah, I guess the key difference a lot with an ADHD profile is, and again, I feel these days that ADHD doesn't actually do it justice in its name. It's not specifically about attention deficit. It's not just a child that is running havoc around a classroom. We're finding more and more with the complexities as we learn about the brain that actually, a lot of the time, what it can be is a focus issue. We find as kids get a little bit older and they're suddenly having to sit and focus. That can be the challenge. Or there's so much, I always say, general noise in their head that they're not hearing instruction, they're not computing instruction. So to me, that's more of an ADHD picture. And that's where, for the right child, and again, there's a lot of science out there that says medicate first line. Am I for or against that? I think, again, it's very child specific. It's very age specific and what we're actually
Mm.
trying to glean with outcomes. But the good thing about some of the medications with ADHD is that we can turn the noise down.
Yes.
And by doing that, we can then get traction with a lot of the other things that we're trying to do, be that nutritionally,
Mm.
functional medicine perspective, the likes of you and I might do. It could be OT, it could be speech, it could be psychology. But if this is too loud, nothing breaks through. The autism child, as you rightly said, there is no medication out there. There's no miraculous kind of cure of suddenly bringing my child back online, of suddenly getting them to sit still, or suddenly just getting them to engage emotionally. I feel with autism, it's almost more complex. And I'm sure there's people out there that would challenge my thought process. I would love that. But yeah, with autism, it's just digging deep and finding common pathways and common threads, but also realizing you almost have to come at it gently and slowly for a lot of these kids because there's so much going on at a biochemical level that we can't even see. We're seeing that physical presentation of a disengaged child or a nonverbal child, whatever it might be, but we have to work really hard at finding the reasons why and then supporting
Mm.
those as best we can.
And I couldn't agree more. And when it comes to things like environmental toxins, there's a lot of talk around environmental toxins like BPA or phthalates and how exposure to those, especially some people are more genetically susceptible, I guess, how that contributes to ASD. What are your thoughts? What do you see clinically?
Yeah, I mean, there's over 100,000, I reckon, toxins in our environment. I mean, the key thing to note is that we have very little understanding as to
Yeah.
how all, if not a majority of those directly impact humanity. And I think that there's some really good epidemiological studies that have actually shown an association with neurodivergence, ASD and ADHD specifically, and environmental pollutants such as you mentioned, some of the plasticizers, so your BPAs. Now, BPAs are used commonly in production of plastics, in PVCs. They're used in production of some of the resins that go on the inside of our cans and food containers. So whilst we're getting a lot of it through our diet,
Mm.
yes, we're also then getting it through inhalation. It's also in our personal care products. Now, the hypothesis with the science is that the connection with BPA and ASD is due to the genetic inability with those with ASD to detoxify them through the necessary metabolic and excretion pathways that fundamentally break them down into water-soluble molecules that we can then get rid of.
Right. And so on that front, can you tell if somebody is genetically susceptible? Because I know there'll be parents listening or watching going, how do I find out if my child is a genetically susceptible person to not being able to detoxify these environmental chemicals?
Yeah, I mean, from a naturopathic perspective, it comes from, yes, taking a comprehensive history and looking at symptomatology. So if you're rocking up with your child and there's a whole number of things going on, more often than not, chronic constipation, which again tells me that there is inflammation in the gut, which just naturally tells me that there's detox issues. If a child's not pooping, they're not detoxing. It's the main way that a child will get rid of toxins, in inverted commas. It's also important to know that a kid's detoxification system isn't even mature. I think it's late teens, early 20s before our detox pathways are actually mature enough to get rid of a lot of this stuff. And then it becomes like unpacking a beautiful parcel. It's like peeling off layers. And I do functional testing, and I know we're going to go on and talk about that a little bit later. But again, there's functional testing out there that can give me some insights as to how your child may be detoxing. We can do things like hair mineral analysis testing, which would tell me whether there's a toxic load. But the tests that I prefer doing, just because it gives me so much more information, and when it comes from bang for your buck for functional testing, is the oats test, which we'll unpack in a little bit more detail a bit later, which again, as I said, gives me direct biomarkers to tell me how your child is or is not detoxifying.
Okay, great. This is fantastic for parents to know there are things that they can do in that space that we will get to that absolutely. And what about the role of oxidative stress and this pattern of disrupted detox pathways? How does that intersect with inflammation?
Yeah, so as I mentioned, there's a hypothesis that these ASD kids, their detox pathways are disrupted. So poor detoxification can directly lead to oxidative stress. Now, I guess simply put, oxidative stress is an imbalance between the creation of what we call harmful molecules or reactive oxygen species, which is a bit of a mouthful, and the body's ability to neutralize and get rid of them. So if we've got a reduced detox function, basically means the systems become overwhelmed or compromised, and thereby less effective at clearing out these reactive oxygen species, which fundamentally lead to oxidative stress, which damages cells, which leads to inflammation. And as I mentioned, the oats test, the cool thing is, again, we can actually test for these oxidative stress biomarkers that are linked with ASD in things like the organic acid testing. Yeah, and then again, in ASD, we know that oxidative stress also disrupts things like mitochondrial function, which is critical for energy production. But it also, neuroinflammation is exacerbated by oxidative stress. So again, there's another vicious cycle that we get stuck in here. So addressing obviously gut function to improve detoxification is naturally just going to begin to chip away at some of these issues in this very complex little picture we've got.
A lot of people find hard to understand when they start delving into ASD and all the drivers and what's actually going on is how could so much be going on in this small child? A child that maybe is 5 years old and there's so much complexity. Often the parents will be like, did we do something wrong? Is there something that we're feeding this child, our child, that's causing this? Because it seems quite overwhelming that so much can be going on in such a small little individual. What kind of advice do you have for parents that say those things and have those feelings?
It's very natural. The key thing I always
Yeah.
say is please don't beat yourself up about it. This hindsight's always everyone's best friend is my other thing is I'm here to help educate. I'm here to help inform where it's there's things we could probably all do better in life.
Yeah.
However, we're presented with the child that we're presented with right here and now, and we're still empowered to do something about it because it's biochemical. There are things we can do. Because genes can be turned on and turned off, there are things we can do. So I guess, yeah, the key message for me, is always with parents. It's not the end of the world. We can still do something about it. I appreciate for some parents it's incredibly challenging and very heartbreaking, and you only ever want the best for your little ones, for sure.
Okay.
We can improve things. We can turn down the brain fire. We can improve the inflammation. We get some really beautiful results coming out of these kids. With some hard work, I'm here to help.
Yeah, I love that. What about early feeding patterns or sensitivities, like, I don't know, selective eating or just early exposure to sort of different foods that maybe didn't fit in the gut? And how does that influence neurodevelopment? Because for me, for example, clinically, even I did an intake call last week and the mum was saying, oh, look, I think it's my fault. My child is 4.5. He only eats bread and pasta. I probably should have done more to increase his range, but that's all he'd eat. If I put something else in front of him, he'd never eat it. So I just end up giving him what he eats. But how does that actually influence neurodevelopment or change gut microbiome? What's going on there?
Going on. Yeah, so we mentioned there's obviously many, many things that influence microbiome in early life. We've touched on some of the prenatal stuff. And I guess in addition to that, there's infections, there's medications, there's mode of birth, there's the way in which a baby was fed. Are they breastfed? Are they formula fed? And we know that mum's microbiome has a big impact, both through development and then obviously through birth canal, if it's a natural birth, and then on through into breastfeeding as well. As we introduce solids, again, this ASD cohort of kids are a little higher, shall we say, in the world of selective eating.
Yeah.
We know by some of the stuff that we've already mentioned that what is going on with some of that gut-brain axis is actually driving the areas of the brain that make them more sensitive to textures, flavors, colors. But obviously, less diversity in the diet means less diversity in the microbiome, which again leads to susceptibility for infections, inflammation, compromised immune systems, neuroinflammation. So yeah, again, we're back in this old vicious cycle that we're having to at some point cut in and break. But I think it's probably a perfect time to also say that dietary refusal and withdrawal in ASD isn't a behavioral non-compliance issue. It's a sign to the likes of you and I, or any other medical professionals out there kind of listening. It's an indicator of a medical issue. There's something underneath it. So it isn't a case of my kid's refusing and oh my God, it's so difficult.
Yeah.
There's an underlying cause. And that again is a signpost to me as a practitioner to start digging deeper to find out why.
I love that you say it is a big red flag for a practitioner because parents will always revert to the guilt, the blame on themselves, but it is a very big red flag for us to go, yeah, we need to look further into this. So there's other hypotheses around ASD. There's also one that I've read about called the stress model. So can you explain a little bit more about this side of things?
Yeah, I guess it's the model that proposes an interaction between, I guess, the nervous system, the immune system, and the metabolic systems, and how they are altered by stress and inflammation, specifically in utero, that leads to ASD. So the stress hormone, or CRH, I'm not going to spell that one out for you, releases due to stress, and this goes on to impair glucose utilization, which affects brain development. So quite a simple model, I guess, but not just specifically brain development, but the areas that are linked with social and sensory processing. So again, a really cute link through to ASD. So I guess, yeah, what we're saying is that mum's stress levels through preconception, through birth and beyond are affecting obviously everything that goes on with baby, all thanks to biochemistry. And again, not a blame game. It's a case of now we know these things and there's ways to support these things. So again, it's empowering in that regard.
Yeah. And we can't go back and turn back time. This is the thing. And then anything else that we want to cover in part one? There's so many interconnected mechanisms. We've got nutrition, we've got inflammation, we've got toxins and the way we process toxins. We've got epigenetics, how our genes work. How do you actually prioritize? To me, this is a really hard one to work out, but how do you tackle this? Where do you start?
Where do I start? I dig deep.
Yeah.
Yeah, my history taking is like nothing I've ever done before, because I always like to say it's everything beyond the child. So you have a child in front of you, and yes, taking a symptom history, a behavioral history, mood, sleep, all that stuff, it's almost the easy stuff. What you're looking at with these kids is everything outside of that child as well. So unique, comprehensive familial histories, going back as far as people are able to tell me. It's like, what's the environment like? What's the support structure like? Like, we need a very almost like 5-dimensional history from these cases. And then within that, I'm then looking for common pathways. There's always a lot to consider. You're right. It's like we're looking to improve gut function and microbiome. We're looking at improving malabsorption and maldigestion issues and reducing inflammation. And so the pile kind of goes up. But I guess I've got a bit of a theory that always goes gut first. So first line, it's like we're treating the gut. And again, that varies from child to child. I do see a lot of constipation, but if a kid's not going to the bathroom, that is a number one priority. It's affecting obviously nutritional absorption, but it's affecting their sleep patterns. It's affecting their behavior. It's upsetting the entire family. And it's incredibly stressful, Just one, what you might call tiny little bathroom issue. Yeah, so as you said, it's just finding, and then it might be finding what's causing some of the gut inflammation. So are they constipated because they've got parasites? Are they constipated for other reasons? Because if we can turn down some of the inflammation, we can just begin to chip away at getting better nutrient absorption involved, which, as I said, will improve sleep. It will begin to improve behavior. And we can begin to just turn down some of this biochemical noise in the body, which means we can then start revisiting things like supporting neurotransmitter production, further work on detox pathways, further work on reducing neuroinflammation. It's a big job.
It's a huge job. It's a really big job. And I definitely know when working with parents in this space that often they will have done some kind of DIY detox, but yet the child's constipated and then you get an exacerbation because, of course, if their gut health isn't reasonably okay and then you do a detox, it's just going to go pear-shaped. And there's so many things that can possibly not go wrong if you treat things out of order, so to speak. So I really love how you focus very naturopathically, of course, but on gut first, because I've seen it clinically many times where patients, they have regressed because there's been some intervention done that just the timing and the order was just out of place.
Yeah, for sure. We're complex little beings.
Yeah, we sure are. Now, for part one, are there any myths that you want to bust or any last thoughts for part one, Lynn?
It's a good interlude before part two to just say, I think, a take-home message of inclusivity and compassion with these kids. And I will take this opportunity to push it out there. It's an ASD child is as unique as any other. I always like to say to my parents, it's like their brains are just wired with more sparkles. And you just have to understand that that's beautiful and every child is a gift. And I think as awareness and education improve, we're beginning to see a shift away from a lot of the stigmas. And then I guess from my perspective, I get excited as a bit of a science nerd that as science evolves and delves deeper and gives us more insights, that it just gives me more ways and more inroads to help these childs and their families find their way.
Wonderful. Well, thank you so much for joining us for part one. You'll be back for part two. I look
Yes.
forward to chatting to you very soon.
Thanks.
Don't forget to join us for part two of this interview on autism, where we will cover dietary interventions and treatments. Thanks for being with me today. Don't forget to like this video and hit that subscribe button below. Check out the links in the show notes for more health information and feel free to ask any questions in the comments below.